In this video, Stefano, Alberto, Daniele along with me will guide you through the treatment for trapezius contractures using trigger point techniques step by step, the upper, middle and bottom. Let's go. We will begin with the description and anatomy of the trapezius muscle, because this is very important for us to apply the techniques correctly later. The trapezius muscle originates from different places. The first is at the occipital bone on this horizontal line. Another origin is located at the C7 vertebra and covers all vertebrae up to D12, which is located right here. Its insertions are the lateral fibers and the upper fibers in the clavicular section, the middle fibers at the scapular spine, and the lower fibers at the bottom of the scapula. Now, let's identify the anatomical reference points. The reference points are, as we said, C7, which we can find by performing flexion-extension mobilizations, where the C7 vertebra goes forward. From here we can do another test to see if it rotates with respect to the D1 vertebra, making rotational movements of the head, as you can see. As it moves, we see that this identified vertebra is C7, because if it were D1, it obviously wouldn't move. Concerning the lower part of all vertebral insertions, down to D12 we locate it by tracing the lower rib margin of the 12th thoracic rib. Next, we locate the scapular spine by following the medial margin and going upward. We observe a depression here. This is the scapular spine, extending to the area near the acromioclavicular joint. Note that the trapezius muscle is mainly innervated by the accessory nerve, the 11th cranial nerve. Next, we will examine the movements in relation to the fibers. The elevation movement is provided by the upper fibers of the trapezius, the adduction movement of the scapulae provided by the middle fibers of the trapezius, and the lower fibers are responsible for scapular depression, as you can see. Now we will search for the trigger points of the upper fibers of the trapezius muscle. Our search should focus on finding the taut band, which indicates an abnormal state of tension in the muscle fiber. Practically at the top of the trapezius, we follow the muscle's path, and once we palpate the taut band, we can enhance our search by putting the trapezius under tension, slightly tilting the head, keeping in mind that the trapezius originates from the occipital area. Once we find the taut band, three situations may arise. Local pain may be present, or pain may radiate from the same point either upwards or downwards, and small fasciculations might appear visibly while staying in the same spot. After identifying the trigger point, we apply digital pressure to create a situation of low blood flow, or rather hypovascularization, which creates a relative ischemia. We keep the pressure for about a minute and a half, or until we feel the taut band release under our thumb. At this stage, the pain perceived by the patient decreases, and if there is any eventual fasciculation, it tends to disappear as well. The technique we just reviewed is a point pressure that helps us easily locate the taut band. The trapezius muscle is one that anatomically allows us to use a different grip as well, which is the pinching grip, enabling us to find and treat other trigger points also in the middle fibers, as we are doing now, carrying out nearly the same technique we just explained, but employing this different grip. Now we will execute the technique on the lower trapezius fibers. How do we engage the lower fibers? We request the patient to pull back both the shoulder and elbow so that a contraction is created that makes the entire margin of the trapezius stand out, as you can see, and thus also the lower part. At this point, we pinch the muscle in the lower branch and ask the patient to release the contraction to grasp the lower fibers of the trapezius this way, in this manner. Our objective is always to locate the taut band and discover, as we have seen before, the area of local or referred pain, according to the patient, or we can find fasciculations, as we have noted. At this stage, we perform the technique as we have seen before, maintaining this compression for approximately 90 seconds to deactivate the trigger point of the lower trapezius fibers. This will act on the pain perceived by the patient, which tends to decrease, and if any fasciculation happens, as we've said, it tends to go away as well. We can apply another technique. The one we just used is one, and this is another that involves accessing the deep fibers like this, which lets us find and address other trigger points as well. Thank you for watching our video on how to treat trapezius contractures with the trigger point technique. Don't forget to subscribe to our channel, like the video, and leave your comments below. Be sure to watch the video on how to treat sciatica and the treatment for lower back pain. You can view them by clicking on the side thumbnails. Take a look at the link in the description to explore our courses and keep enhancing your skills. We'll see you in the next video.